Here to discuss it is Lindsay Susie, the Clinical Director for Sweetser's New England Eating Disorders Program. We have Dr. Mark Kaplan, Sweetser's Medical Director, Sweetser's Training Specialist, Steve Neske,
Michael Maudlin,
Jane Van Bramer, she's Sweetser's President and CEO.
Justin Chenette, a spokesperson from Sweetser, Hannah Schlotterbeck, a Sweetser school-based clinician, Sweetser's HR Director, Carol Mundigler, Sweetser's Director of Crisis Services is Alyssa Pelchat, Sweetser's Director of Recovery Services, Elena Knox, Sweetser's Affiliate Network Manager, Jan Du Bois, is Mike Andrick, Sweetser's Senior Director of Adult Crisis and Residential Services, Sweetser's Senior Director of Community Services, Wendy Anders,
Sweetser's Certified Community Behavioral Health Clinic Director, Joey Rossignol.
What do you tell teens or young people who are struggling with hopelessness or depression?
Well, I think you tell them that there is help available and there is hope available, that they don't have to feel this way, that they can be connected to services, that we can help them feel better.
Lindsay Susie is the Clinical Director at the New England Eating Disorder Program. She says that they treat people as young as 13 years old.
Eating disorders impact all ages, all races, all genders, all socioeconomic groups. And they don't all look the same.
Our expert staff at Sweetser's New England Eating Disorders Program have been supporting teens and adults with a safe and non-judgmental path towards healing and health. Our high-quality specialized eating disorder treatment is run by a multidisciplinary team to support individuals and families through the recovery process.
I was really going down the wrong route when I was a kid, and I feel like coming here really changed my life around. I had a lot of troubles when I was a kid, a lot of anger issues, stuff like that, a lot of trauma. And I felt like everyone was just very accommodating, everyone wanted to help.
It means we need to change the trajectory of this trend from negative to positive. It means we have to put in the immediate work now to save our youth, to save our collective future. It's very uplifting to know that when Sweetser needs the help of our community partners, Lowe's stands at the ready to answer that call. Your work today will make a difference in the lives of all the families and children that pass through our campus. Without people like you, without companies like Lowe's and Maine Community Bank, without organizations like the Sam L. Cohen Foundation and the Rotary Club of Saco Sunset Bay, without the Pendleton Fund, Sweetser would not be successful in creating promising futures for the children, adults, and families we serve.
Tell us, what is really being done right now to kind of help people directly and indirectly impacted by this tragedy, by this, continuing kind of stress that we're under, with all this mental health support that we need? What can be done?
Sure, well, we are meeting the moment, and we are mobilizing and coordinating all our available resources and staff to meet the need in the Lewiston area. What does that mean? Well, we are redeploying crisis staff to the areas that are most needed. We're authorizing overtime, and we're working very closely with our community providers and other behavioral health organizations to make sure that we are making the best use of services.
Our crisis numbers are available for anybody. First responders, law enforcement, newscasters, whoever it is, because we all need it. We all need it. This is a terrifying experience.
It's sometimes a bit much to have one group do everything, so the liaison, I can direct folks toward the right resources.
Michael Maudlin is 1 month into his new job. Before coming here, he had prior experience as a police officer and as a social worker.
Go to WMTW.com for resources, crisis lines, expert help, and free mental health first aid training.
Mental health awareness on Maine's Total Coverage, brought to you by Sweetser, providing treatment, support, and hope to Mainers.
And we'll bring you personal stories and ways to take care of each other.
Your mental health matters. Sweetser and News Center Maine are reducing the stigma attached to seeking treatment and support for behavioral health. Sweetser is here for you.
In summary, this bill before you would allow the Department of Education to set up a grant-like incentive for schools to contract with a behavioral health provider to provide school-based therapy services. This would reduce costs for schools, help financially stabilize the program for providers like us, and ensure students get the mental health support they and their families really need.
The Maine Department of Health and Human Services Committee unanimously voted to support funding a PRTF. If funding gets approved, Sweetser says a facility in Maine should be up and running within 8 to 9 months.
Is really a level of care that we desperately need in Maine. These kids need to be brought home where their families are, where their friends are, where their communities are.
A new mental health and substance use clinic is now open in York County.
That's thanks to $4 million in federal money. This is a grant. Behavioral health provider Sweetser is opening up the clinic in Sanford.
This location on Main Street is now ready to handle people dealing with any type of mental health and substance abuse issues right here in York County. From walk-in services to a 24/7 crisis response treatment, there are staff members here ready to meet people where they are and provide them with the resources or services that they need.
This program will allow us to serve about 750 more children and adults.
Fundraising total for this tournament.
Every unit has both our Rockport and our Saco unit have a therapist here, a licensed clinician that either has a master's in social work or a master's in professional counseling. We have a supervisor at every unit that runs the day-to-day to make sure that everything is running smoothly and supervises the unit. And then we have behavioral health professionals, and those are the folks that are with the kids 24 hours a day that really offer them the support, teach them coping skills.
Meanwhile, at this Brunswick campus of Sweetser, counselors are teaching a free course that anyone can join to learn how to recognize mental health struggles and how to help. It's a class that more people and businesses have been signing up for, says Sweetser training specialist Steve Neske.
Because oftentimes people are like, I don't know what to say, I don't know what to do. And so this model gives them steps of assessing, listening, giving reassurance, and then encouraging both professional and self-help support.